I just am thinking in my own mind, are there times that I'm moving away and jumping into the extremity when I really just need to be patient and give this cervical or thoracic component some time to fully resolve if she describes 50% better? Or are there times that I'm hanging on and just beating up that spine, looking for that derangement when it's telling me that, okay, there's something else going on as well? And to know the difference there, I think, can be a challenge for clinicians who are earlier on or just maybe haven't seen the volume, haven't been around other clinicians that are thinking similarly.
Yeah, I think you're right. It's difficult. The thing is, I'm always trying to understand through classification. What is this thing? What's going on? I'm never ever not investigating. Mark likes to joke about this at times. He's like, "Yeah, I assess until they're better, they're gone." And that's what this is. It's constant assessment and investigation. Your brain should be working 24 hours a day, 7 days a week, trying to understand what this assessment process is doing for this individual. What is going on? Did I do this? Have I ruled out lateral at this point? Do I need to keep on going? Where am I at for this? And if that's not showing change, okay, I've done this, I've done that. Anything else left? No, I got to move down the chain. Where are we going on here? The symptoms are still on their arm. What's going on here? Is there anything there? No, there's nothing here. Let me go back up. Let me put more pressure. There's something you're always looking to understand where it is, and you want to be as systematic as you can, because if you leave something out in the spine and you missed it, you've lost 2 or 3 visits before you come back to it again. Mm-hmm. And in this day and age, with limited number of visits, and we're seeing more and more of this, you only got a handful of visits to get it right, and even have less than that to get the patient's, support and interest and motivation to do things. So you want to make sure you try to be as systematic as you can, but at the same time, not lose their interest. It is an interesting challenge. If you can't get to an answer in the spine, and you're pushing at it, and it's not really giving you what you need to do, what you want to do with it for the extremity, you got to look in the extremity at some point, else you're going to lose the patient. So you have to keep the patient involved, but at the same time, you can always pick and choose. I still want you to try this movement here, but let's do this little thing here in the arm or the wrist or the elbow. You have to apply something to give them, like, I'm working towards your goal.
Yeah.
All right.
Yeah. No, that's good. Yeah. Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.